Hey everyone, Luke here with the Joint Replacement Therapist. Today what I want to talk about is one of my favorite exercises to do for either prehab or preparation before surgery or rehab after your joint replacement surgery, and that is the deadlift. So a lot of people when you say the word deadlift, they get this kind of nervous look on their face. I think people think a lot about the big, heavy power lifters and weightlifters lifting up, hundreds and hundreds of pounds, or they might think of possibilities of susceptibility of the back and causing back injuries and problems. And so people kind of veer away from the deadlift and don't really like it that much. But I'm here to say that the deadlift, when you do it appropriately and correctly, is actually a really great exercise and builds a lot of strength and helps with a ton of different things. So one thing to know is when you do deadlifts, you don't have to necessarily use a big barbell and load it up with a ton of weight. We like to use kettlebells. I also have used dumbbells, either in two hands or one hand. And so there's different ways to really modify the amount of weight so you're not doing too much and not having risk of injury or bad form. Another thing you can do is change the height of the surface you're performing the deadlift from, and that allows you to, if you have trouble getting into this deep position, or you have trouble maintaining a good spine position, or you have pain in the knees or the hips with bending down that far, you can raise the height of where you start the deadlift from to make it a little easier and still get all the same benefits. So today I'm going to show you the kettlebell deadlift. I love using the kettlebell again because you can modify the weight, make it nice and light and appropriate so you can progress up. And also it's easy enough to change the height of where the kettlebell is. So as you see here, I have a nice step underneath the kettlebell to bring it up a little bit higher, and of course you can add some more steps the higher up you need it, or even I've used big textbook in the past to give you that extra couple inches up if you need to. All right, so for the kettlebell deadlift, what you're going to do, so your starting position, you're going to have feet about shoulder width apart, a little bit further. You might have to go a little further, especially if you have a step that the weight is on. About shoulder width, maybe a little bit farther apart. Doesn't have to be super wide. Toes are going to be pointed forward, or you can actually point them out a little bit, whichever is more comfortable for you. You're going to come down into this hip hinge position. So if you've seen a couple of my last Instagram posts, I really talk about the hip hinge and the importance of the hip hinge. So you're really bending the hips and bringing your bottom back. And that allows you to keep that nice straight neutral spine as you come down. And of course there's some bend in the knees as well. So flexion and coming backwards, keep a nice neutral spine, or a little bit of extension, a little bit of arch in the low back is okay, but more or less we want nice neutral spine. So you're going to come down to that position. Arms, you're going to have a pronated position, or palms down I like to use. Sometimes when you do barbell deadlift, you might have this alternated position, one arm up, one palm up, one palm down. But with the kettlebell, I just use a pronated, both hands down position. You're going to have your elbows nice and straight. So the majority or all of the work is going to come from your hips and your legs. And so the arms are really kind of a passive part of this. They're almost like a rope just attaching to the weight. So elbows straight, you don't want to work the biceps will do in the deadlift. The last thing is head. Should be in a nice neutral alignment with the spine, looking a little bit forward. You can have a little bit of extension. We just don't want this super hyperextension of the spine because that will start to cause some arching of the back as well. Chest, you want chest up and outward. That's going to help maintain that neutral spine, not this curled down look. All right, so that's your starting position like this. And then all you're going to do, keeping the arms nice and straight, all the movement's going to come from the knees and the hips. So together you're going to extend the knees and hips, come up to this erect, fully erect position, everything extended and straight. And then same thing, maintaining that neutral spine. You're going to flex, form your hip hinge, and come down to the starting position. Very simple once you get all the pieces together. The best thing to do is make sure you have that good hip hinge movement. So check out some of the old Instagram posts over the last couple of days showing you maintain that good neutral spine. If you're able to do that and able to raise up the surface a little more, then you're really doing good work to protect your low back with good technique and also not overdoing it with the weight or the range that you're using. All right, so just one more time. Good hip hinge, neutral spine, and you lift up and extend, and then back down. Nice and slow and controlled. Of course, you want to start with light weight, maybe some more repetitions. Have a physical therapist or a knowledgeable trainer or someone similar to really help you with technique, watch you, see what they can help you improve, and that way you're going to avoid injury and get all the benefits of strengthening all the muscles of your glutes, your hamstrings, even your quads and your calf muscles as well. So it's a great exercise. Please don't shy away from it. Here's just one simple variation that I like to use with my joint replacement individuals. There's also, of course, using the barbell. There's using dumbbells as well, and I'll show some examples of that in some later videos. Okay, so thank you very much for watching, everyone. Have a great day.